Hello, my name is Maureen, and in this short training, I'll walk through the essential component of cognitive behavioral therapy, or what we call CBT, and describe the populations that benefit most from it. So, I will also share a brief example of client or patient statements and corresponding CBT aligned responses. I will start with the CBC model. So CBT is based on the idea that thoughts, emotions, and behavior are interconnected. So when a person changes the way they think, they can influence how they feel and how they act. For instance, or example, a client with depression may think, I'm a variant, which leads to sadness and withdrawal. So the CBT help interact that cycle by examining the thought and replacing it with something more balanced. For instance, we have cognitive restructuring. One major component of CBT is cognitive restructuring. And this is involve identifying automatic thoughts, evaluating the evidence, and developing more realistic alternatives. So, for instance, if a patient say, everything at work I think I'm incompetent, I might respond in this situation. Let's look at the evidence for that thought and the evidence against it. This helps the client shift from emotion reasoning to a more accurate interpretation. So we also have behavioral activation, another core component, and this is where behavioral activation, which is especially effective for depression. When client or patient avoid activities, their mood worsens. So behavioral activation help them to again engage with meaningful or present task. For example, a patient can ask, I don't feel like doing anything. Or I might say, let's choose one small activities today that usually give you a sense of accomplishment. So this small step help break the cycle of an avoidance. In the situation like skills training, so CBC also includes skill training. These may involve grounding techniques, relaxation strategies, or problem solving skills. For instance, if a patient say, when I get anxious, my heart races and I feel out of control. So in this situation or scenario, I might respond, let practice grounding technique to help your body settle when those symptoms start. So these skills give clients tools they can use outside the session. We come on the side of homework, which is another essential part of CBT. So patient may complete thought logs, activities, schedules, or behavioral experiment. This practice reinforce learning and help client apply skills in real life situation. We have also depression as population based on by CBT, and in this category the CBT is highly effective when it comes to depression, and so it helps clients challenge oppressed thoughts and increase engagement in meaningful activities. A patient or a client might say, nothing will ever change. I couldn't respond. Let's explore that thought and identify one small action that help you feel even slightly better than before. I'll also go through about the patient with anxiety disorders. So the CBT is also effective for generalized anxiety and panic disorder. It's help client challenge catastrophic thinking and learn coping skills. If a patient say, if my heart races, I'm going to die, I might respond to this patient. Let's examine that thought and practice a grounding skill to help your body regulate. We can also discuss about the PTSD therapy. And so for PTD, CBT help client challenge trauma-related belief such as self-blame and gradually approach avoidance, memory, or situation. For instance, if a patient say, it was my fault, I might respond, let's look at the fact and explore whether that belief is accurate or fair. We do also have patients with insomnia and adolescent. So CBC here is the gold standard for chronic insomnia. Using sleep restriction, stimulus control, and distracting unhelpful sleep-related thought, the CBT is also highly effective for adolescents because the structure is skill-based approach fit the environmental need. So I would put in summary, CBT is a structured, practical, and highly adaptive to brief PMHNP encounters, even small interventions such as challenging a thought, teaching a grounding skill, or scheduling a meaningful activity, and can significantly improve the client outcome. Thank you for listening.